Good morning, everyone. Good morning to our stakeholders and our partners in health. So we, the Community Nurses of Toronto, is proud to present our advocacy for people living with HIV in Toronto. So I have with me my fellow community nurses, Miss Abigail Gomez.
Morning.
And Miss Maria Joviana Reynaldo.
Hello, good morning.
And also with us is Jasmine Santos.
Hi.
And yours truly, Maria Lisette Gongora. So these are the key statistics for people living with HIV in Toronto. So overall, HIV rates cases per 100,000 people in Toronto exceed the rest of Ontario. So 17.4 in Toronto, while 3.1 in Ontario. So 4 in 5 newly cases were diagnosed are male, and 16% of HIV cases in Toronto acquired their illness outside of Canada. So in Toronto, an estimated of 15 to 25% of HIV persons are unaware of their diagnosis. Approximately 1/3 of the cases are identified with immunodeficiency development, and 10% are diagnosed late in their HIV course of treatment. So Toronto has a particularly high burden of HIV with a provincial rate, which is twice the average of the provincial rate. And also groups at high risk of HIV include men who have sex with men, and injection of drug users, and Aboriginal persons, and persons who immigrate from regions with high rates of HIV. So in the city of Toronto, these are the actions and recommendations done with this HIV. So diagnosis of HIV is the only gateway for getting the needed care and treatment. So the Toronto Public Health recommends healthcare providers be aware of their patients' HIV status. Then also to assess the role for routine testing, in Toronto Public Health recommends piloting routine HIV testing in acute care centers, in high prevalence areas, and in high risk settings such as addiction clinics, STI clinics, with the goal of identifying cases of HIV earlier to reduce transmission and increase of uptake of treatment. So our political action project, or a brief description of our project, will be discussed by Abigail Gomez.
We advocate to reduce the stigma and discrimination that create vulnerability to people living with HIV by raising awareness and support a campaign that promotes inclusion and respect. We advocate also to improve the access to testing, treatments, and ongoing care, support for people living with HIV in Toronto through strong partnership and intersectoral collaboration. Why people living with HIV? So living with HIV can be challenging experience. Many people face stigma, discrimination because of their status, HIV, social determinants of health, as well as HIV can have effects in our relationship with our significant other, and also with depression, low esteem, and anxiety, and other mental health challenges are common in people living with HIV.
So our advocacy also focuses on the theories and approaches like the social justice. This includes the social determinants of health and equity, which was explained earlier, and it is being viewed as the opportunities or equal rights that includes right to good health. So this includes all the gender inequality, racism, and LGBTQ discriminations, which are frequent social justice advocacy issues. So they have equal rights and should receive care regardless of their gender preference. So another model is ecological model.
So ecological model recognize multiple levels of influence on the health behavior, including the interpersonal individual factor, which is influenced by behaviors such as knowledge, attitude, beliefs, and personality. And another factor will be the interpersonal factor. It will be as such interaction with other people, which can provide social support or create barriers to interpersonal growth that promotes healthy behavior. One another, it will be the institutional and organizational factor, include the rules, regulation, policies, and informational structure that constrain or promote healthy behavior. Community factor such as formal or informal social norm that exists among individuals, group, or organization can limit or enhance a healthy behavior. Public or policy factor include the local, state, federal policy, and law that regulates or support health action and practices for disease prevention, including early detection, control, and management.
So this will be our goals and our action plan. Our goal is to reduce the stigma and discrimination that create vulnerabilities to people living with HIV by raising awareness and support campaign that promote inclusion and respect. The second is to promote access to testing, treatment, and ongoing care and support for people living with HIV in Toronto through strong partnership and intersectoral collaboration. Next slide, please. Our strategies is to engage and empower community through consultation with the LGBTQ and the indigenous people living with HIV, particularly leaders groups, to understand how to address their needs in terms of accessibility to treatment and support to help them identify the gaps in services and develop prevention treatment plans for this vulnerable population. Also, we will advocate for clinical care for everyone, psychological support and socioeconomic support, and respect for human rights for people living with HIV in Toronto. Another thing is create peer groups with shared experience on HIV to enhance support system and reduce the discrimination in the community. So, one is to optimize the system, sectors, and partnership for the impact. We will do this by forming a coalition or partnership with the organization to support gaps in accessibility of health services for people with living with HIV, with current organizations like Ontario HIV Treatment Network, the Ontario AIDS Network, and we will also advocate for support of funding from present organizations in advocacy dissemination like the HIV Resources Ontario to invest in innovative methods to spread awareness and innovation actions for people living with HIV to reduce the discrimination in the community. So that will be our strategies.
Here we have our outcome and evaluation in regards to our political action project. And the outcome here is increased access to testing, treatment, and ongoing care and support for people living with HIV in Toronto. And also reduction of stigma and discrimination by promotion of inclusion and respect of people living with HIV in Toronto. And the plan to evaluate this outcome are through review of national program reports, interviews and review of records, health facility and household surveys, and also the focus group discussion. Next slide, please. We have also indicated here the ethical consideration, which are autonomy, ethics of care, and respect for client well-being. The autonomy, the patient's ability and right to self-governance, while nurses are advocate to support the treatment and prevention of this disease. We also must respect the right of people living with HIV to refuse treatment and decide what is best for his well-being. While ethics of care, we must provide caring, nurturing care, and act in the best interest of the clients and to help client achieve optimal health outcomes. And lastly, respect client well-being. As nurses, we must also respect client well-being and must provide all health care services irrespective of gender and sexual preference and advocate to social justice and reduce social discrimination.
So overall, in our group, as we deep dive into knowing the experiences of these people living with HIV and the experiences of their stigma and discrimination, we are truly inspired by their resilience and determination as community nurses. We shall commit to provide the leadership that will reinforce to reduce health inequities among vulnerable population like people living with HIV, and assert that human rights and support and acceptance for this group as we work together to be part of the solution to this problem. I hope you fellow stakeholders and our partners in health to support and be part of this health solution. Thank you for listening and have a great day.